Hi, everyone. Welcome to our town hall. The board is in session. I am Libby Garvey, chair of the Arlington County Board. I want to welcome everyone to what I hope, and we all hope, will be a series of virtual town halls that will help you get the information you need as we all cope with this COVID-19 pandemic. I think we've all heard the projections and watched communities around the world and in the country struggle to provide medical care to those who've been sickened by the coronavirus. Today, we here in Arlington are all now largely confined to our homes. Our daily lives have been drastically disrupted. People we love have gotten sick or know someone who's gotten sick. We've lost lives here in Arlington, and we will lose more. Today, we want to talk about what we're doing and about how you can help so we can all work together to slow the spread of this terrible virus in our community and save lives. With me today are my colleagues on the county board, Christian Dorsey, Katie Crystal, and Matt DeFerranti. Vice Chair Eric Gutschall is dealing with a serious health issue and cannot be with us today. We also have our county manager, Mark Schwartz, and our deputy county manager, Jim Schwartz. They are here to help provide the latest information and answer any questions and receive comments that you may have. They are among the many Arlington employees on the front lines fighting this epidemic. And I want everyone to know that they've been working hard since January when we saw this pandemic coming. So our plan today, I think you could put up the first slide. Our plan today is for each of us to talk for a few minutes about one part of what your county government is doing and about what we need for you to do to fight this virus so we can get our lives and our community back to something close to normal as quickly as possible. You can submit your questions and comments at any time. Next slide, it may be there. At any time, and we will be gathering those comments, and when appropriate, we're going to group them together with other similar questions. We'll answer as many questions as we can, and once we're finished with our brief presentations. If your question requires a personal follow-up, please let us know how to reach you. You could submit your questions by Facebook chat box, or you can text them to 571-356-9267. Now I'll turn it over to Christian Dorsey, who will be followed by Katie Crystal, then Matt DeFerranti, and then I will return to conclude the presentation part of our program, and we'll take questions. Christian? So at the moment to staff, this is Libby. I cannot hear Christian.
Thank you, Madam Chair. I apologize for the delay. I was on mute. Can you hear me now?
I can very clearly. Thank you, Christian. Take it away.
Hello, I'm board member Christian Dorsey, and the county board understands that in this unprecedented medical and economic emergency, it is vital for county government to continue to provide essential services and so much more. Since our declaration on March 13th, Arlington has been in an emergency footing to manage the COVID-19 crisis. Essential services continue with modifications to keep our workforce safe. Critical safety net programs continue and have been enhanced to meet the human needs that have arisen. Non-essential services and programs have been curtailed or modified, and our public facilities are largely closed. And while we continue to keep maintaining our infrastructure, testing the water, repairing the pipes, policing our streets, and providing other services to our community, our focus has been on a coordinated response to the pandemic and involves working with Arlington Public Schools, Virginia Hospital Center, neighboring jurisdictions, the region, the state, and federal government. The pandemic response is federally supported, state-directed, and locally executed, because without a vaccine or effective therapies, it will take each and every one of us to slow the spread of this socially transmittable disease. Thus, an essential part of our emergency operations is keeping our community informed and engaging with you to understand your needs. Now, you should understand, we can move to the next slide, that we are in the acceleration phase of the COVID-19 pandemic. How long it will last and how severe it will be are unknown at this time, but we should all expect to measure it in months, not weeks. And while it remains true that most who contract COVID-19 will experience mild symptoms, without controlling community spread, the number that require hospitalization and who get seriously sick will far exceed existing hospital capacity. Additionally, the state's medical infrastructure is already strained. So we have been working regionally to increase capacity at our hospitals. They are prepared to scale up by adding beds, and we have a regional plan to provide even more beds if necessary. And due to local foresight, we have no current shortages in PPE, and at the moment, there are no shortages of necessary medical equipment. But there is cause for concern if we experience a significant surge. And of course, in any surge scenario, the key issue that we have not yet solved for is the availability of trained medical personnel. And that is why flattening the curve, the graphic that has now become ubiquitous, is so important. If we don't experience a surge in cases that overwhelms the system, then we can reduce the number of deaths, not only from COVID, but also from other illnesses, while preserving staffing levels to meet medical needs for the duration of this pandemic.
Good afternoon, everyone. I'm board member Katie Crystal. We know that the measures that are needed to prevent the worst health consequences that Christian just alluded to in our community are exacting an incredible toll on everyone. And that is especially true for those who have lost their income or access to services that are usually provided by closed facilities. So we are focused on supporting our community members in meeting their basic needs, food and shelter, and working where we can to help minimize financial stress. To address the immediate need of low-income families for food, Arlington has provided an additional $100,000 to AFAC, the Arlington Food Assistance Center, to bolster their operations and allow them to get food to families who need it, irrespective of referral. The state has also increased SNAP food subsidy payments to households to the maximum allowed for their size for the months of March and April. And we are particularly attuned to a couple of groups at high risk for hunger or nutrition deficiency, children and seniors. So APS has been providing students with breakfast and lunches daily, and today they will provide families with a week's worth of meals to get them through the upcoming spring break next week. In addition, the county is delivering meals to participants from the Parks and Recreation Congregate Meal Program for seniors while community centers are closed, and Meals on Wheels is still available to participants. Regarding financial support, the Department of Human Services is working with the county's nonprofit partners to provide cash assistance to low-income families who cannot meet basic needs. We are expanding support to those households affected by the COVID-19 outbreak. We have also appealed to landlords and property owners to show the maximum flexibility to those who've had their ability to pay rent impacted by the pandemic. We thank those property owners and landlords who have stepped up to do so. We are also glad to share that the governor and the state courts and our local courts have temporarily stayed any eviction proceedings through the end of April. And our treasurer has suspended penalties and interest on business taxes that are paid late. Our economic development team is connecting local small businesses to resources that can help them. We also know that there are other consequences from the stay-at-home order, especially for mental and behavioral health. Being largely confined indoors, sometimes in close quarters, can be incredibly stressful, and it can compromise your emotional and physical well-being. A recent poll by the Kaiser Foundation, conducted just last week and published yesterday, found that 45% of adults in this country say that the pandemic has affected their mental health. 19% have said that it has had a major impact. As the Washington Post said when they were reporting on the survey, this poll makes one thing clear. If you are scared or anxious or depressed or struggling to sleep through the night or just on edge, you are not alone. And that's what we want to communicate to you too. You are not alone, and there are resources to help. We have COVID-19 mental wellness information on our website, and we'd encourage you to check the CDC's Daily Life and Coping webpage on their coronavirus website. While the county has closed parks, playgrounds, and fields in order to discourage gatherings, and because we cannot keep the equipment properly sanitized, our 49 miles of trails are open. We encourage you to use them to walk, jog, or bike, but please do so safely, keeping at least a 6-foot different distance from others. We know that this kind of exercise strengthens our immune systems and can give you a welcome break from the stress. And if you or anyone you know needs help, please consult these resources listed here for assistance on everything from domestic violence to other mental and behavioral health needs.
Good afternoon, everyone. I'm Board Member Matt DeFranti. We expect that over time, more needs will emerge and county government will be prepared to meet those needs as best we can. Yet the most important role in our successfully responding to this pandemic is yours. We need everyone to stay home as much as possible. This is absolutely vital. We know how difficult it is, but our only defenses against this virus are effective social distancing and personal hygiene. Per Governor Northam's Executive Order 53 to stay home, legitimate reasons to leave your home include seeking medical attention, work, care for family or household members, or obtaining goods and services like groceries and prescriptions. Visit the governor's website at virginia.gov/coronavirus/ for more information and to read the details of Executive Order 53. If you must go out, we need you to avoid social gatherings of more than 10 people. And at all times, maintain at least that 6 feet of separation from others. Be mindful of compromising those with serious health risks. Even if you are young or otherwise healthy, you can get sick yourself and your actions can increase the risk for others. We know that this virus is transmitted even when you have no symptoms. So in addition to washing your hands frequently, you need to clean and disinfect frequently touched objects and surfaces like your phone. Even though we're all largely confined to our homes, there are still ways that you can help others. Social distancing does not have to mean social isolation. If you're in a lower risk group, reach out to your higher risk neighbors in need. Ask how you can help, maybe by picking up prescriptions, groceries, or offering other assistance. You can also check your neighborhood, building, civic association, communications tools, Nextdoor, Facebook, or other tools that can help you keep in touch while being physically separate. If you have the resources, and only if you have the resources, I'd ask that you think about donating to Arlington's many safety net nonprofits, which are under tremendous pressure right now to provide food, shelter and housing, medical care, and emergency financial support to so many. Volunteer Arlington is maintaining a list of what those organizations need. Their website, the county's website, or the Arlington Public Schools website are available to help you help others.
Thank you, Matt. Thank you for all our colleagues. I think I speak for all of my colleagues when I say that we realize the toll this virus has already taken on everyone, the losses that we are all experiencing. We know the toll it's taking on families with children who's struggling to do distance learning and come up with creative ways to fill free time when you're largely confined to your homes. We know how isolated and vulnerable some of our seniors are feeling and how frightened our residents are who are immune compromised. We know that some people have missed family weddings and seen graduations canceled. And we know that many are experiencing far worse than inconveniences and disruptions to daily routines. Many people have lost jobs and are now wondering how they will support their families, pay their rent, make their mortgage payment, put food on the table. Many people have seen their businesses shuttered and have been forced to lay off employees. Some have been sickened by this virus or have seen loved ones sickened. Tragically, we've already lost members of our community to COVID-19. As Matt noted, So many people in our community are putting themselves in harm's way to help others. We're grateful to them all. These people, are our community heroes, and they deserve our appreciation and need our support. At last count, the number of active cases in our region exceeded 2,500. Those cases will continue to climb, as will the number who die. We know how hard it is to not know when this emergency will be over. But everything we are asking of you, staying at home if possible, planning your trips so you minimize going out, practicing social distancing, and being rigorous about hygiene, washing your hands, all of this is absolutely necessary for us to get through this storm so that we as a community can come out stronger on the other side. This is a good time for everyone to make themselves a COVID-19 plan. Think about 2 people you could call on for help if you get sick. We need to start planning now because we really are just at the beginning of this. Now, my colleagues and I and our staff here are happy to take your questions. Our clerk, Kendra Jacobs, is collating them and will read the questions, and then we will try to move through them and answer as many as well as we can. Ms. Jacobs, would you like to read the first question, please?
Yes, thank you very much, Chair Garvey. We have some great questions coming in. Our first one has to do with the election process. Will the primary election on June 9th proceed in Arlington?
So I think I could answer that one. I don't know. We think so. We hope so. And how it will proceed, we don't know. I've been in touch with the registrar. Everyone's trying to figure this out. In the state, there are places having actually even more important elections for the positions themselves in May. And even for them, it's not clear exactly what's going to happen. So this is one of those issues where we have to stay tuned. It's important. We're all committed to our democracy. We'll make sure, I think, that it goes forward in some way. But I think people should be prepared probably to be doing absentee ballots. I hope that helps. Do any of my colleagues have something they want to add? Okay. Ms. Jacobs, next question, please.
Okay, our next question, and our Assistant County Manager James Schwartz might want to weigh in on this, but the next question is, what sites in Arlington will be used as overflow bed space?
Thank you. Yes, I think Jim or Mark, that's for you.
So this is Jim. The choice of alternative care sites is actually made at the state level. The governor has already announced a site for the Northern Virginia area that is not in Arlington. The details of that are still being worked out. It is likely to be a large site with what is known as arena-style care. The people in the public and the community may have seen pictures of this kind of thing where lots of beds are arranged in a wide open space. The challenge for all of the surge activities is providing the staff necessary to care for those that go to those facilities. Our hospitals, both here in Arlington and in the region, are planning for surge capabilities on their own campuses, within their own facilities, and have extended their capabilities to quite a large degree. As far as the alternative care sites are concerned, we're monitoring the decisions by the state and the plans to stand those up. We are also looking at the possibility of using smaller facilities, perhaps here in Arlington, but have not made any decisions as yet.
Thank you. Next question.
Okay. What has been done in the county to protect the incarcerated population, especially those with medical conditions?
Thank you for that question. Mark, I think that might be for you.
I'm going to
Jim.
I'm going to actually let Jim do that because he's been in conversations with Sheriff Arthur.
Thank you.
So as you might expect in a facility like the county jail, the sheriff has long had plans to deal with illness within the jail. Although COVID obviously is a novel kind of circumstance, illness in the jail is a fairly regular occurrence. And so they are constantly taking precautions to separate those that are sick and may be in a position to transmit whatever the illness is. The sheriff has medical staff in the jail that are able to support their efforts. They have also been issued personal protective equipment to be able to safeguard those that may become ill in the jail and to protect the staff that is there. In addition to that, many in the community may have heard that Virginia Hospital Center a few weeks ago stood up a collection site for testing, and some of the materials, some of the equipment necessary to do that testing was given to the sheriff so that her medical staff can actually do that testing for symptomatic people that are in the jail, so that we can stay ahead of any potential for transmission there. As of yet, there have been no cases identified within the jail.
Thank you, Jim. Next question, please.
Okay, our next question is, how will Arlington enforce gatherings of 10 or more people? I know that is a very popular question right now.
That is. Mark, is that one for you?
Let me start there, and I think that I spoke to this when we had our last public meeting on this subject. The enforcement resources we have in the county related to what go on in our parks are, we have park rangers and park monitors who are been working diligently to talk to people who are gathering in groups and not staying 6 feet apart from each other, giving them verbal warnings to stay apart. And for the most part, especially over the last few days, we have found that people are being respectful when they're told that and following through on that. On occasion, we have some recalcitrant individuals, requires perhaps a stronger voice from our park rangers. And then in what I consider to be an unfortunate set of circumstances, if we have to call the police, we will, but our police have much more important things to do, and they're concerned themselves with making sure their ranks remain full and that they're not put in a situation where they're unnecessarily exposed. So that is essentially our goal is not to punish people, but to have people practice good social behavior. And as I've said before, it's good to be outside, and that's an opportunity for you to remind your neighbors to practice good social distancing.
Thank you, Mark. Next question.
Yes, thank you. So along the same lines of exercise and being outside, we have a question. In DC, members of the same household may play tennis together. Why can't Arlington reopen the tennis courts?
Mark, I think that might be for you again. It's basically the enforcement issue, I think.
Well, and I know that Mr. Dorsey asked a very similar question to that last week. And, if you're applying the principle of staying 6 feet apart, there is on its face really nothing particularly horrible about standing on a tennis court 40 feet apart and hitting a ball. The problem becomes in trying to carve out an exception and open up some of the park facilities. I realize this is a situation where we're perhaps painting with a broad brush, but we are left with limited resources. I wish if we could have that sort of fine-tuned kind of enforcement, we would be able to do it. And the other thing I would add, and I've said this before, is that we will be revisiting these issues on a weekly basis. And as of now, we just really, it's unfortunate. We would encourage people to stay away from the courts and instead stay in the open spaces 6 feet apart from each other.
Thank you. Do any of my colleagues want to comment on this general issue of the parks and enforcement?
Libby, I will say a word, which
Yes.
is I'm noticing a lot of comments in the chat about exactly this, as you were describing the general issue. Should I be concerned if the neighborhood kids are playing basketball in a shared hoop? Why are these elements of the park open? Why aren't these? And I think that the really important thing is to just encourage everyone to return to first principles here, which is we know that if we can stay 6 feet apart and avoid transmission of COVID-19, or excuse me, of the coronavirus that causes COVID-19 through respirated droplets, then we are going to have our best ability to slow the curve and slow the growth of this disease in our community. And it really does come back down to that basic principle. The community or the county will try to continue to give guidance, make closures informed by that principle. But as you are making decisions about your family, your neighbors, your life, that is the one to come back to. Can an activity be done safely 6 feet away from other people?
Thank you. And as the manager said, right now we have sort of limited tools, and we will keep revisiting things, but we need to do the best we can as quickly as we can, which is what we're doing. Next question, please.
Okay, some of the models predict a peak in mid-May for the DMV region. This is from the University of Washington model that they're referencing. Is this consistent with your expectations for peak?
I think that maybe is a Jim Schwartz question.
Thank you, Madam Chair. So there is work being done on modeling for this particular virus. And in fact, the state, the Virginia Department of Health, is doing modeling with the University of Virginia, which is really where we're getting more data from. The thing about the models that I think people should perhaps focus on was something that Dr. Anthony Fauci said just a couple of days ago, and that is that the models have just enormous variability. There are so many things to be considered, especially at this fairly early stage in the evolution of the virus. And so the models are not telling us a lot as yet. They may tell us more as time goes on, but we are working with both Commonwealth of Virginia on modeling that they have commissioned through the state universities. And we are also looking at some data that is going to be applied to the National Capital Region as a whole, to the metropolitan area that includes Arlington, that may give us some indications of where things are going, but nothing definitive at this point.
Thank you. Jim, I'd like to make two observations. You can correct me if I'm wrong. The first thing about the model and how it works, it depends on how well we do right here with social distancing and staying at home and avoiding the spread, so that's how we can affect our own model by our own actions. Is that correct?
That's absolutely true, Madam Chair. The heart of all of this is, regardless of what the models are showing, it is our own personal behaviors that are going to stem the evolution of this virus.
Thank you. And then the other issue I'd like to point out is if we manage to flatten the curve, that doesn't mean that we're done, right? It will take quite a while staying at a sort of steady level, I believe. Could you talk a little bit about that? People, I know we can't say how long this will go on, but I know a lot of people are wondering about that. Could you comment?
Yeah, you're absolutely right again. The purpose of flattening the curve is all to reduce the demand on the healthcare system. What we've seen in some of the places in Europe where the amount of people needing hospitalization, needing critical care just exceeds the capacity of the healthcare system. And the idea of flattening the curve is to reduce the day-to-day impact on the healthcare system so that it doesn't become overwhelmed, so that there are enough ventilators for those that need them. There is enough staff to provide that critical care. But the cost of doing that is that we will be in this for a longer period of time. Now, that means that more people will survive, so there's a benefit to this. But it means that the kinds of practices that we've been in for the last several weeks around social distancing and not gathering in groups of more than 10 people, those things are going to continue for longer than they might if we had the effective crash of the healthcare system. We would be over it more quickly, but we would certainly lose more Arlingtonians, we would lose more Americans, and we would not be able to keep up with the demand in the healthcare system.
Thank you. Next question, please.
Okay, so just sort of jumping back over to the issue of hospital beds. The question is, are there alternative spaces that are being refurbished now, such as hotels, other available properties, to prepare for a likely surge in hospital overflow?
Yes, thank you. I think that's a Jim Schwartz question again, I think.
Yep. So again, the governor is in a position of choosing the alternative care sites. We are looking at some potential contingencies here in Arlington, such as the questioner points to the use of empty hotels. That is under consideration for us. But I have to really underscore here that the alternative care centers, wherever they end up being located, the big unknown at this point is where the equipment and the staffing for such centers is going to come from. The hospitals who would normally provide this are concentrating on providing the surge capabilities at their own facilities. They've done a very good job of increasing the capacities, the potential capacities, should we hit those surge marks. But that means that their staff and equipment is focused there on their campuses and will be unavailable for the alternative care sites that are still being planned for.
Thank you. In other words, I think we focus on beds a lot because we read about that, but it really is, the beds are maybe the easiest part of that that equation. It's the staff and the equipment. Thank you. Next question, please.
Okay, Derek from Walker Chapel United Methodist Church asks, is there anything in particular faith communities can do to help our neighbors through this? That's a great question, Derek.
It's a great question. Christian, would you like to take that one?
Thank you, Madam Chair. So Derek, thank you for that question. And, you know, so many of our faith communities are devoted to active ministries. And during this era of social distancing and staying at home, it's very difficult for church members to effectuate those very worthwhile efforts in the community. What I would suggest is that you form a volunteer network within your church where you assess the capability of people to provide either neighbor to neighbor care or who have other skills which might be useful should we need to, for example, expand the number of medically trained personnel who are deployed to this effort, people who are able to devote time and use of their vehicles to transport goods to people who need them, namely food. If churches can be the place that organizes its members so that we know the capacity, we can then link you to the broader Arlington volunteer networks so that as needed and if needed, you can actively play a part in meeting the community need.
Thank you very much. I'd like to put in another suggestion, which I talked to earlier about everyone needing a COVID-19 plan. If church communities could work to ensure that every member of their congregation has such a plan and knows what they will do if they get sick, and has at least 2 people that they can call on, I think that would be really helpful and make what the work we're doing, stronger. And I really appreciate the question and that thought. Do any of my colleagues want to add anything to this, either Matt or Katie?
Not on this one. Thanks.
That's fine. Thank you. Next question, please.
Okay, so this is a topic that you all have been talking about a lot lately in your conversations around the community. Why is social distancing and hand washing so important?
Oh, excellent question. Matt, do you want to take that one? Let's start.
Sure. I think there have been a couple of questions that have touched on how concerned people are about when might be the peak. At this time, we really, the tools that we have to prevent the spread of this virus and save lives are really, those are the key tools. We know that COVID-19 can be passed even before you show symptoms. So the spread can come through being in proximity, and you pick it up from other people as you pass them in the grocery store, or you could be anywhere and pick it up. So keeping outside that 6-foot distance is really the way to stop this spread and stop the growth of this disease, which already is such a challenge. So that's on the 6-foot spread and social distancing, and staying home as a way of ensuring that and really protecting yourself.
Thank you. Do my colleagues want to add anything? Katie, Christian?
This is Christian, just to speak to the hand washing piece. Even though it seems like a very old school technology, there's nothing that has been developed that replaces the ability to rid germs from the skin, then rigorous hand washing for at least 20 seconds with soap. It's even better than hand sanitizer. Hand sanitizer will do in a pinch, but the soap and water, rigorous hand washing removes the germs, the virus from your skin. And as you go through your daily life, you realize how often your hands actually end up touching your face, even when you don't intend to. And by constantly tending to that hand washing, you reduce the transmission risk of things that you may touch, then coming into your own respiratory system, causing you to contract the virus.
Thank you. I think this is a really, really important message and question and point. So I'm going to invite Jim Schwartz to actually, if you would like, talk a little bit more about how this virus actually works and spreads. I think that might help people understand a little bit.
Well, so Madam Chair, I don't have an MD after my name, nor an MPH. But I think that what both Mr. DeFerranti and Mr. Dorsey talked about bears reinforcing that this is a virus that is transmitted by respiratory droplet. When we sneeze or when things come out of our mouths inadvertently, if they land on other people or other surfaces and we touch those, if it happens to contain the virus, then that is the means of transmission. Viruses are living things, and they have figured out how to maintain themselves in transmission. And obviously, one of the things that is of benefit to them is that they are unseen. And so the social distancing is what it is believed that the 6 feet is essentially the distance that a droplet can travel before dropping to the ground. And then the idea of washing hands is, as Mr. Dorsey emphasized, how we keep from transmitting things to our nose, our mouth, our eyes, which is the entry point for the virus for us and the continued transmission in the community.
Thank you very much. And then I will just add that I have noticed we haven't had winter this year, but if you think back to when it's really cold and you're outside with friends and everybody's breathing and everybody's breath shows in the air and the vapor, or you walk by somebody who's smoking and the smoke cloud is pretty big and widespread, I think that's just an indication of why we need to be 6 feet apart. In the good weather like this, we don't see it, but think about in the winter with vapor, when people are breathing, you can see how much you can see that, and the same thing with smoke. So the 6 feet is really important. All right, ready for the next question, I think.
All righty, our next question is, what does the governor's new stay-at-home order mean for Arlingtonians?
All right, Katie, would you like to take that one?
Sure, Madam Chair, I'd be happy to do that. So as you all have been following, the governor issued a statement earlier this week with the expectation that all Virginians will now stay at home, except for essential personnel and except for essential reasons. We have been working very hard to get that message out, and I think actually it has been noted to or by most Arlingtonians right now. I think we've already talked on the piece about enforcement and what that means in our community, the priority that we have, that our police and our park rangers or roamers have to trying to disperse any gathering of 10 or more people has been a priority. And so we are continuing to follow that consistent with what we have heard from the governor. Again, I think most Arlingtonians are pretty familiar with this at this point, but basically the implications of that order is that we are asking for people, or rather the governor is asking for people to stay home, with exceptions for buying food, caring for a family member, seeking medical attention, going to work for an essential business. The governor's order does allow for individual exercise compliant with social distancing guidelines, which is what we've talked a little bit about with our parks now too. So I think in some ways that order really formalizes a lot of the conversation we've been having thus far on the town hall.
Thank you. Next question, please.
Okay, so how is Arlington coordinating with other local jurisdictions, DC, Fairfax, Maryland?
I'm doing a lot of coordinating here on the regional level in Virginia, but when it comes to the other, I think maybe Christian, as our representative on the COG board, perhaps you could take that, and then I'd like to ask Mark Schwartz to talk a little bit about what he's doing with his colleagues. Christian?
Yeah, I'll start, and I think we probably all could add a little bit to this. When it comes to regional coordination, one, it's recognizing that Arlington, as Mr. Schwartz, Jim Schwartz said earlier, is within the National Capital Region, and it's an area where working in concert is really essential, since there's already existing great mobility among people within all of these jurisdictions. People who live in Arlington work in Bethesda and vice versa. So ensuring that all three broad jurisdictions and the cities and counties within are coordinated with the same message is really essential. So the Council of Governments has gotten the local jurisdictional governments to issue a joint statement, which essentially reflects the stay-at-home guidance that we have been providing and encouraging, urging, requiring our community to rigorously adhere to social distancing. That's point number one. Point number two is really trying to figure out how regionally we can respond to the issue of capacity, having available medical personnel to deal with surges, and continuing the cooperation that's present when it comes to mutual aid for public safety that's been a part of the National Capital Region for a while.
Thank you. And this is a big issue, and I think I'm going to ask actually everyone to comment. I know, Katie, you've worked particularly on transportation. Would you like to talk a little bit about what you're doing?
Sure. And I think, a lot of the questions that we've been handling or talking about so far have been about crisis response, which is obviously at the top of mind for everyone, including the region as well as local government. But as the social distancing orders continue, a lot of our conversations have been about how to maintain our systems for the long haul in a dramatically altered daily state. And I think that's been especially true for transportation with WMATA, as well as with other transit networks like the Virginia Railway Express, of which Arlington is a part. We've been in as close a coordination as possible, trying to be aware of and help disseminate information about closures. As some in our community, for example, have seen, Metro made the decision to close a couple of stations in Arlington, as well as otherwise through the system, on the basis of the inability to keep the full stations clean and sanitized. We've been in close touch, for example, with Metro bus operators about the safety precautions that the system can take for them, including precautions that you'll now see on Metro bus as well as ART buses, which are rear boarding to allow distance from the bus drivers themselves. And again, we do continue to really encourage everyone in the same way. We're trying to ask you to protect our medical professional and first responders by staying home. We're asking you to protect our transit operators and drivers as well by not riding transit unless it is for an absolutely essential reason.
Thank you. Matt, would you like to address this question a little bit?
Sure. Just briefly, there is the Northern Virginia Regional Commission provides a daily update for our situational awareness that helps inform, I know, the work that we're doing just to understand what other local jurisdictions are doing on a day-by-day basis. And I think that's been a significant resource. They've also provided some data analysis that's been helpful. So those are pieces that are important. And I know we've already touched on the regional hospital approach. So I think there's a lot of different ways we're working regionally.
Absolutely. Thank you. And then the Northern Virginia Regional Commission has also set up a call twice a week for the mayors and chairs. And I get on that call and we trade ideas and, what are people seeing? What are we worried about? What do we need help with? They've organized calls for us with the governor to try to let the governor know what it's like here on the ground. And that's helpful. And from time to time, my counterparts more than Northern Virginia than across the river, but we just pick up the phone and call each other every now and then. I think we're all doing that. It's really crucial. So I'd like to go to the Mr. Schwartz, Mark and Jim, to talk a little bit, because I know both of you are doing a lot of work to coordinate it. It's absolutely crucial. Who would like to start?
I'll take that, Madam Chair. Thank you. So one point which we practice a lot, which is it's much easier in an emergency to collaborate with your colleagues if you've built up those relationships beforehand. Towards the end of 2019, it turns out that COG, Council of Governments, had sponsored a tabletop exercise on a similar set of circumstances. And I was able to sit there with our emergency manager and our public health official with all the other jurisdictions in the region and talk through some of the issues we're facing today. We have actually every morning, all the public health officers have a phone call with each other. I have been in constant communication with my colleagues who are administrative officers in Fairfax, Alexandria, Prince William, Loudoun, the district, and also our Maryland colleagues. And as has already been referenced, the Northern Virginia Hospital Alliance. And then in Northern Virginia, we have something called the Emergency Response System that was set up after 9/11. And we have, fortunately for us, that is where we've stockpiled a lot of resources that we are able to make access to. But I would just say people should not be concerned that we're not consulting. I'm suffering from a little bit of video meeting fatigue because we're doing a lot of consulting. So Jim, if you have anything to add on that.
Yeah, Jim? And I'll just say, Jim, I think you've been working on emergency preparedness in the region since at least 9/11, yes?
Well, actually, Madam Chair, I would say that much of the benefits that we are reaping today in this crisis go back as long as 40 years. They certainly paid dividends on 9/11, but the relationships that Mark was just talking about, the caching of equipment and supplies that has been sitting, somewhat dormant, you might say, for a number of years, is now paying the dividends of those relationships. And those are something that leaders like Mark are constantly trying to reinforce to the next generation of people that come in, to this arena or arrive from elsewhere in the country, because Northern Virginia and I would say the metropolitan Washington area, under the auspices of COG, has some of the strongest regional relationships and interdependencies anywhere in the country.
Thank you, Jim. All right, thank you all. Next question, please.
Okay. Our next question is, how is the county reaching out with COVID-19 information to our large immigrant communities? And they wanted to also make a point that this information needs to be provided in Spanish and other major languages.
Absolutely. Any of my colleagues want to comment? Otherwise, I think I'll throw this to Jim, to Mark.
Oh, I'd be happy just to chime in to say absolutely.
Sure.
We agreed that reaching out to not only Spanish speakers in our community, but Amharic speakers, speakers of Mongolian languages and others is really important. Our key public health messages are available in, I believe, 6 different languages. Our staff is posting a lot of the information on the website in Spanish as well. Although with that information changing, frankly, hourly, it is hard to offer everything in the full array of languages spoken in the county. But I do think perhaps the most important thing to note is that our public health line, 703-228-7999, is available in Spanish as well as English. And so if members of our community don't have access to the internet or are not finding enough information there in the Spanish language, they can talk to a person on Espanol at that line, which I think is an important resource to make sure folks are aware of.
Thank you.
And
Christian, Katie?
also add,
I'm sorry. Christian.
And this is where community organizations have been critical in our work. We engage with a number of organizations which serve non-English speaking communities and keeping them apprised of the latest information. We're thrilled that they're able to turn around providing language specific information for communities who have limited English proficiency. And I want to encourage anyone who is engaged in a network where they are largely engaged with people who do have limited English proficiency to connect with us so that we can ensure that we give you what you need in order to provide the appropriate information to people who are not well served by the voluminous information that's available only in English at this time.
Thank you. And Matt, I know you've worked with our schools a lot on hunger issues with the student population. I don't know if you'd like to comment a little bit.
Well, certainly the points made are important ones. It's been great to see the expansion of the food sites to serve many of our immigrant communities. And so that's a key piece. I think the hashtag together alone or alone together in Spanish, that's juntos solo. And that's something that it's sort of captures the spirit of the partnerships we've been working on, the work with APS. And then beyond that, the efforts to make sure that in multiple languages, all the materials are available as quickly as possible.
Thank you. Mark, would you like to add anything?
I think all has been said, so I will pass it on to somebody else or maybe for a new question.
I think we'll go to a new question then. Next question, please.
Okay, how's the county reaching out to help our neighbors with disabilities and their special needs?
That's another good question. Who would like to start with that? Katie, would you like to start with that one? Katie, if you're speaking, you're on mute, I think.
I know. Can you hear me now?
I can.
Great. I have a little bit of technological difficulty with the frozen screen. I think the most important thing to know is that our Human Services division and branch that works on adult needs and folks with disabilities and behavioral health needs has been in really close touch with their clientele. We don't have the Director of Human Services here with us, but I can tell you she joined Libby and I on an event hosted by Aging Matters on Monday to talk about the amount of outreach that's happening with clients now to ensure that those needs are met, whether those might be transportation, food delivery, or others. So there is a lot of active outreach. I think one of the things that has prepared Arlington County to take on this crisis is how active and healthy that Bureau of Aging and Disability Services already is to be able to know where the needs are in our community and reach out to meet them.
Okay. Any of my colleagues want to comment more, and then I will ask Mark to talk a little because I know he's working, our DHS department is working very hard. Christian or Matt, anything you'd like to add?
Just say we do have organizations. Again, community partnerships are what really makes it work for us to meet the needs of each and every one. Organizations such as Arlington Neighborhood Villages, which already existed prior to the COVID pandemic to connect people with disabilities and our senior community to folks who could essentially serve as that buddy that you recommended, Ms. Garvey. That organization is recruiting volunteers and working to meet the needs who are connected through that network. And I encourage people to look at Volunteer Arlington for organizations that are serving the disabled community and to enlist to help if you can provide assistance.
Thank you. Mark, would you like to talk a little bit about what DHS is doing?
Yeah, and I think that that part has been fairly well covered by both Ms. Crystal and Mr. Dorsey, but I did want to elaborate a little bit further on a point that's been made, which is that we often get the question, what is the county doing to serve population A or population B? And I just wanted to, so everybody understands this pretty clearly, the county government itself will not be able to succeed in this without partnerships with members of the community. And I'm thinking specifically, the Department of Human Services started out working with the Arlington Food Assistance Center, and we determined very quickly that there is nothing in place in our county, and perhaps many other jurisdictions, where we could deliver food to people in homes, perhaps people who are disabled, who aren't able to make it out. So we're in the process right now of working very closely as a partnership between the government and between some trusted people in the community to put together what is essentially a feeding network, which has never existed before. And we are going to need the help from a lot of people. And if people are interested in helping with that, Mr. Dorsey already said they can reach out to Volunteer Arlington, and there'll be a lot more information coming out. So that's just an example, looking at Maslow's hierarchy of needs. When it comes to food and shelter and basic health care, we can do a lot, but we can do a lot more if we get partners in the community.
Thank you. And I think I'll just add, this really is, it isn't about the government doing this on our own. It really needs to be a team effort with the community. A lot of people are stepping up. I also don't want people to be too complacent in that they're vulnerable populations. And certainly there are populations that are more vulnerable. But if you read about this disease and what's happening, everyone is vulnerable. We all are. And that's why, again, I will urge everyone to start thinking now about what is your own personal COVID-19 plan if you get sick. Thank you. Next question, please.
Okay, Madam Chair. So we have a lot of great questions coming through. We're not going to be able to get to them all. So I will present this as the last question. It has to do with healthcare and healthcare professionals. I am a member of the Arlington Medical Reserve Corps. Is there any system in place to allow healthcare professionals to help out in the community or to plan having them help out if the hospitals get overloaded?
Thank you. I believe so. I believe that is a Jim Schwartz question.
So, Madam Chair, the answer to that question is actually in the question itself. The Medical Reserve Corps is a wonderful resource that we have here in Arlington, but so too do all of our regional partners have their own medical reserve corps. We are actively recruiting for more members of the Medical Reserve Corps. When I mentioned earlier in the conversation the need for staffing for alternate care centers, one of the ideas envisioned is to try and recruit as much of the outpatient healthcare community. That is private doctors, nurses, physicians assistants, those kinds of folks that right now, given the circumstances with both the virus and the economy, most of those offices are not open, are not functioning, certainly at the same level that they were just a few weeks ago. So there is an effort underway to try and recruit more of those healthcare professionals through the Medical Reserve Corps. I think we have information on our website about how people can contact Medical Reserve Corps, but I will verify that, and if it's not there, we will put it in a highlighted place so that people can find it. We are going to need more healthcare professionals as this virus continues to affect our community and our region, and the more that are willing to step up and help, the better we'll all be.
Thank you very much. We have about 4 minutes left. I'm going to invite my colleagues if you'd each like to have a final comment for about a minute, which might work out. Christian, I might start with you if you have any final comments at the moment.
Thank you, Madam Chair. I would just like to thank everyone who participated today, who asked questions. Hopefully we'll find a way to get responses to other people whose questions were not answered, either by providing materials on our website, sending them out in the newsletter, or responding specifically as appropriate. Beyond that, I want to reiterate what you said, Madam Chair, at the very beginning, that we plan to do this regularly so that we can keep in touch with our community, so that you can understand what we're working for, what we're planning for, and the obstacles that we face. But also just to encourage people as we engage in this for the long haul, to understand that despite the fact that it's difficult, it's absolutely necessary. And we need to encourage each other, motivate each other, and support each other so that we can get through this and return to what we hope will be normal as soon as possible.
Thank you. Katie.
Indeed. So if you'll allow me, Madam Chair, I wanted to just confirm one question that I think is really important that I don't know that's been answered yet, which is folks who are uninsured right now, who are interested in where they can get care or can they have access to tests. I'm going to ask, or maybe our manager, Mr. Schwartz, either Mr. Schwartz, to speak to that issue, to our partnership with the free clinic, and whether folks who are uninsured can get tested if prescribed by a medical professional.
The short answer is absolutely. Nobody is going to go without a test or care in our community. And I'll just leave it at that. We have worked out the mechanisms to make sure that the costs are covered. We're actually very close to standing up a telehealth link between Virginia Hospital Center and the free clinic in a matter of a few days. We just signed the agreement on that. And even if people can't make it out to the clinic or the hospital, they need to get in contact with us, and we will arrange to make sure they get the care they need.
Thank you so much. And so in closing, I would just say, we don't want insurance to be a barrier to anybody to seek medical attention or telehealth attention. And similarly, we hope very much and are working hard to make sure that this crisis doesn't mean anyone in our community has to go without the money they need for rent, the food they need, or other access to critical resources. I saw a lot of questions coming in later in the chat, and would just really encourage anyone who is concerned about those needs to see if they couldn't go back and watch this chat from the beginning, see the number of resources that are available, our financial assistance line, our food assistance resources, and those can all also be found on arlingtonva.us. Click on the banner for COVID-19.
Thank you. Matt.
Yeah, thank you, Madam Chair. I just want to, there's a couple other questions where there, in addition to those phone numbers, that COVID-19 page has a ton of resources. One question was with respect to trash pickup, and another question is related to parks. Earlier, the tennis court example came up. And I would just encourage folks to understand, both with respect to trash and all the services that are provided, those individuals who are helping us are in some ways on the front lines of responding, and the same with respect to our parks. So there's both that individual, what we can each do to stay home and wash our hands and keep social distancing, but then I just encourage us. We've seen so many residents doing such great things for us to be gentle and compassionate and aware that we're all going through this together and help each other out to the maximum extent we can.
Thank you. Yeah, nobody's ever been through something like this that's alive today. And I also encourage everyone to stay tuned with the information we've got. This is our first town hall like this. We're, making it up as we go. We would love feedback from people who've been on the call and on our Facebook Live, and let us know how it's working for you. Any suggestions about how we can make it better in the future would be great. I do plan on having us we do plan to do another one. So with that, I hope everybody stays well and take care, and we'll see you all in this format again, possibly next week. Thank you.